Today we're going to talk about the IT band syndrome. In order to talk about that, we need to back up a little bit and talk about what comprises the hip joint. So the hip joint is where the thigh bone or the femur meets the pelvis, and supporting that joint are layers of muscle, cartilage, ligaments, and connective tissue. And that's where the IT band comes into play. On the outside of the hip, there's thick connective tissue that runs from the hip down to the outside of the knee, and connected to that is some musculature, and that's what the thick part is, what comprises the IT band. This structure helps move the whole leg. Hip pain itself can come from inflammation or irritation of any of those structures that I just mentioned. There can be inflammation of a damaged structure, and that'll cause pain. There can be some osteoarthritis, hip tendinitis, bursitis, and IT band syndrome. This is usually caused by poor body mechanics, poor muscle endurance, poor balance. Even chronic low back pain can contribute to hip problems because there'll be some compensation. So what is IT band syndrome? IT band syndrome is an irritation or inflammation anywhere along the IT band, and that's going to be anywhere from the outside of the hip down to the outside below the knee. Some symptoms can be pain with pressing on it anywhere along the outside of the thigh, any pain with weight bearing, especially with walking or going up and down stairs, lying on either side of the body like in bed, lifting your leg to get out of the car, and even pain with running and sports. IT band syndrome doesn't usually resolve itself. It usually arises because there's another problem happening somewhere in the lower back or the lower extremities. For example, people who have chronic low back problems like poor mobility or pain, decrease in lower extremity flexibility, your legs are tight, weak buttock and thigh muscles, and other joint issues like knee arthritis or an old ankle sprain, all those can kind of creep up on you and cause inflammation and irritation at that IT band because it's having to do too much workload than it's supposed to. A lot of times you'll see treatments like anti-inflammatories or a cortisone injection, and a lot of times those are good at taking care of some of the pain, but it's not a long-term solution. It's temporary relief. So if you were to fall and scrape your knee and you went to the doctor and they treated your skin, it would almost be as if you didn't look at why you fell. Do you have a vision problem that maybe you couldn't see the steps? So you'd have your eyes treated or assessed, or maybe your balance is poor because you had an old stroke. So those are the types of things you'd want to treat instead of just the skin lesion on the knees. Something you can relate to the IT band syndrome. It's usually a result of something else that's happening in the body. So what do you do now? Come to physical therapy. We can diagnose you and see if you actually do have IT band syndrome, and more importantly, diagnose the reason why you're experiencing the IT band syndrome. We'll figure out what your deficits are. Usually it's a matter of strength and mobility somewhere along the hip or below or at the lower back, and we'd work on those. So if you do end up letting your hip pain or your IT syndrome pain go and you kind of ignore your symptoms, long term it's only going to get worse. These problems don't usually go away on their own. You'll end up having chronic pain, you might start limping, and then the limping might start causing problems on other joints and structures of the body. In order to prevent this from snowballing out of control or getting worse, give us a call here at Loudoun Sports Therapy Center. You can click the link below and we'll help you out.